Hi, so today I'm gonna change CVC dressing on my patient. So in the room, I will check the room safety, bed is locked and low position, and I will introduce myself and what I'm gonna do today. And I will also identify my patient by two identifiers. And I'm gonna use body mechanics and PPE. And I introduce myself and I'm gonna explain what I'm gonna do today, and I will have the patient upright position for the procedure. But in the purpose of validation, I will have the mannequin as it is. And I will ask her if she has any questions before I start, and I will also assess if she has any allergy to iodine, betadine, chlorhexidine, or shellfish. And she identified that she doesn't have it. So first thing I need to do is I need to remove the old dressing. And in the reality, I would prefer to wear clean gloves to remove my to do my procedure of removal. But for now, I will just go with my wash it hands because it is really hard to remove it over the mannequin. So I need to remove the tagadum toward the insertion side because I don't want to dislodge the catheter. Okay, listen, let me tell you. You're gonna put this on the patient. And over the insertion side, I will securely over here.
Place it right here. There's gonna be a lasher. I don't have it.
Yeah, measure it, tape it, and then complete the removal. And I will documentate and assess any odor amount, color of drainage if there is any, and I will discard it.
Start with, I do prenatal care again.
Oh, and before I start my procedure, I will have my patient wear her facial mask, and I will wear one on my own too because I don't want to introduce any bacteria to the insertion site from coughing or breath secretions. So before I start the removal of the old dressing, I should have had masks on me, and my patient should have one too. So now I will assess my insertion site. So I will check for any signs of phlebitis, inflammation, infiltration, and swelling, redness like that, and I don't see any. So I can go with my procedure now. So now I need to open my stir
Put the
kit.
water in. I would have tugged it a little bit and make sure that the balloon is in
But
place.
now we don't have a bio patch left in the lab, so I will just use it as my new sterile bio patch. It must be in the package.
I'm gonna put it on the side.
So I will carefully open.
Toss it. I'm now going to do prenatal care again. The toe. So again, I would go away.
And I will wear this mask.
Oh, wait.
So I can change my mask. And take out my sterile
Now
gloves.
that I finished, I will.
At this point, I will have my bio patch in the package,
During the procedure.
opened, and just
I definitely
sterilely
have to
drop
So now that I'm done,
the bio patch over to the sterile field. And if the kit doesn't have, the kit must have, I checked the validation expiration date and it's good. And the kit must
I
have
don't see the words.
Tavardum itself
Okay, so
originally, but since it's been used, I will just add it.
plastic thing, and then I'm gonna say I'm gonna assess their contraindication. I already assessed everything is good. And I'm gonna grab this and I'm gonna measure it from usually
Can you record it for us? We can leave it on charge while you're recording.
okay, so after that I'm gonna do those, the ears, the first process, and
Yeah.
so I'm gonna go from here to here, and then from the nose to here.
No. From there to there, and then place your finger wherever you got there, and then go down.
Okay, and then I'm gonna place it around, put the finger around
Yeah.
it. And then after that,
So I haven't touched anything inside or the equipment, so it's remaining sterile.
okay, and then
Because I just don't get it, like, with
Now
the
I need to put on my sterile glove.
keep around it.
You're slowing up the balloon.
Once I put it in.
Resistance.
I will
Okay, can you
gently
kind of walk
open.
me through it right now?
Okay, then for me to verify placement, I do a
If I can
full
get this
standard
out of the way
X-ray,
right now, and then
or I could
just
take
stay
gastric
here.
contents out the pH
Because you're gonna
2.5,
come back.
or I could,
But you're not really doing CVC.
okay, then I go back 30 milliliters of whatever.
Save my videos tomorrow. Come into farm tomorrow. Okay, I'm gonna bring my iPad tomorrow and I'll airdrop them on there.
What are you doing?
Only touching the
I
one.
know how to clean. I know like with the leg position, and then I know how to open up
When
the
would I do
sterile
this?
kit. Once you take it out, like you put on your sterile gloves, then you take it out. Oh, you put the
Put this
shiny
on.
put the shiny side down. But I don't get this part. Like,
So now what you're gonna do is from here, it's easier if you just put it here.
okay,
You're gonna put him here, sterile hands.
explain everything.
So what you're gonna do now is you're going to get
Forceps,
and you're gonna clean the same way you did prenatal care, and but you're gonna add the eye
perineal care.
whatever the hell. it's called. So you're gonna clean that, whatever, and then you're gonna
Stop.
make sure you add
Is this with the
And I already assessed the patient for allergies to
and then
betadine,
now you're going to add the lube.
chloroxine.
Before you touch him, add the lube, because I didn't do that.
Yes,
So
this.
touch him.
Put in this on the patient.
You're gonna add this, and then you just put it on the side, and then you're gonna.
So I will activate the medication by squeezing the ends.
So,
You're gonna
And I start cleaning from the insertion site. I vigorously rub
when it's
more
easy.
than 15
Also
seconds.
put the lube in here when it's easy.
And then I can go toward outward.
So you're gonna clean, and then you're done cleaning, you're gonna take this blue thing off.
So
you're gonna
I will
pour it
keep
in, and you're gonna put the lube
rubbing
on it, and you're just gonna
vigorously.
put it in. And then when you're done putting it in, you're gonna
And I will
put the
use the
water in,
Q-tip
and
to
you're gonna
hold
it a little bit
my
more
catheter.
for make sure it's in at the right spot, and then you're gonna hang it. That's done. And you take it out.
And
you're
I'll be
gonna clean it.
careful not to touch the catheter
You're
with
going to syringe back and you'll
chloropal.
take
Or
some
actually,
of
the
that.
tube, I'm gonna be looking for any contraindications such as like a deviated septum, basal skull fracture,
I don't know, I don't
any type
remember
of
doing that.
And I'll clean enough space for the tagadam.
indication
No,
that
I know, I have to come to this.
And I wouldn't touch anything
set up by,
except the equipment with my sterile hands. I'll be careful
right
with that.
nostril.
And then after finishing my cleaning, I will let time for it to dry.
From the nose to the earlobe, then to the.
And then when it's done drying, I will have my bio patch at this point.
You wanna do it right now, you take off the-
No, I want to do it right now.
So
Because
I
if I
will
come back later-
hold a bio patch like I'm flying airplane. Like this. And I will carefully have it in position. And then now I can apply new Tagadon to the site.
Usually I lube this up before I put this in.
So I will be careful not to have wrinkles over the dressing site.
So usually the patient would have, I've been giving them water, and then as soon as I hit resistance, I lift his head up.
And then in the original Tagadam that we had in the
Replacing the
kit
fully tube where
has
you put your lubricant.
like white patch where we can document our initial time and date.
Okay.
So I will write that and I put it here.
This is what I just meant. Oh, she's doing this thing.
And then I will assess the new dressing site again, and then I will check the patient for any pain, discomfort, and I will ask her if she has any questions before I leave. So I will remove my supplies, I clean them, and I put the patient in a comfortable position again. I will check this bed locking, and then I will document my procedure and the patient's reaction to that, and that concludes my validation.